Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
I have some really exciting information to share with you on today's episode about omega-3 fatty acids. They are in the news once again, and I'm going to tell you all about this latest research, plus just talk about why omega-3 fatty acids are so critical to our overall existence. They are essential. So if we are lacking them completely, that's not a good thing. So we have to be getting exposure to omega-3 fatty acids. And how do we go about doing that? Generally speaking, we know our diet is going to be lacking in that, especially if you follow a standard American diet. So supplementation is certainly warranted. So I'm going to go into all of that for you today. I am Amanda Williams, MD, MPH. So let's get right to the science. This just came out just this week. This was a study that was funded through the National Institute of Health and published through the American Academy of Neurology. And what they were looking at was the intake of omega-3 fatty acids coming from diet, and if that intake of those omega-3 fatty acids would counteract the effects of air pollution on the brain. Well, it didn't really surprise me to find their findings after knowing how much research has gone into looking at the way that omega-3 fatty acids actually protect the brain through the aging process. And I'll get into a study that actually looked at that quite extensively, and it's really kind of interesting how they did it through MRI imaging. So in the Journal of Neurology, the American Academy of Neurology, they were looking at the overall intake of omega-3 fatty acids in women who lived in areas of high levels of air pollution. And they were trying to draw that correlation, saying, okay, if the women who had the highest intake of omega-3 fatty acids coming from things like fish in their diet, would this actually lead to have a protective effect in terms of the air pollution damage that can occur within the brain? It's interesting, when we think about air pollution, oftentimes we think about maybe lung damage, or we think about the effects that it has on the skin in terms of accelerating the aging effect within the skin itself, or we look at, obviously cardiovascular issues that have certainly been linked to air pollution. But we also know that air pollution can impact the health of our brain. So in this particular study, they looked at over 1,300 women whose average age was right around 70 years old. Now, not anyone in the study had dementia. So these were all women who, no one had mild cognitive impairment or Alzheimer's disease. And basically what they did is they completed these questionnaires on their diet, and they were looking at their physical activity, they were looking at their medical history, and most importantly, they were calculating the average amount of fish the women were consuming on a regular basis. Now, one of the areas that they left out was deep fried, because the deep fried fish actually, that is damaging to the omega-3 fatty acids. So you're not going to be obtaining any type of omega-3 from a deep fried piece of fish. So always remember, you want to try and do your fish in more of a grilled or broiled or baked would be more ideal. So after adjusting from all of these other factors that could impact the aging rate of the brain, what they were able to see was that the women that had the highest level of omega-3 fatty acids in their blood also had the greatest volume of the hippocampus. So they were looking specifically at certain regions in the brain, and which control our memory, our cognition, all of our functional abilities. And the findings suggest that higher levels of omega-3 fatty acids in the blood from consumption of fish, just from the diet, may preserve brain volume as women get older. I think that this is really quite key. One of the areas that they were able to recognize was that the exposure to different air pollutants was accelerating the aging of the brain. So women who were even in areas where they had high pollution, if they had higher intake of omega-3s, it helped to offset the negative effect. So really kind of some cool research. But let me take you back to a study where they were looking at the Mediterranean diet and brain structure. And this was in a multi-ethnic cohort study. This was published in the Journal of Neurology a few years ago. And they did these functional MRIs, which I always think are really quite interesting. And they did this to determine whether a higher adherence to the Mediterranean diet would be related to a healthier brain volume. And remember, if the brain is starting to atrophy or shrink, that's not a good thing. I always give the example. If you follow a Mediterranean diet, it's like you're signing up to be in the line of the nice, healthy, fat brain. If you're signing up to be in the standard American diet, you're signing yourself into the line of the shrinking brain. We don't want to have that shrinking brain. So this particular study was called the MEDI study, and they were able to recognize from different epidemiological studies over different populations that the Mediterranean diet was indeed the healthiest diet out there, which is why I stress this over and over and over. I mean, there is so much research out there that supports the long-term effects of adherence to a Mediterranean diet. But in this particular study, what they were doing was these MRI scans and looking at basically the size of the brain. So measuring the brain volume, the total brain volume, which I think is really quite interesting. So they were looking at specific areas within the brain. They were looking at the frontal lobe, and the parietal lobe. They're looking at the temporal lobe, looking at all the different regions. And what they were able to basically analyze through this was that participants who had that strong adherence to the Mediterranean diet had significantly greater brain volume. So this is not stuff that's just made up like, oh, hey, you should just follow the Mediterranean diet because they say it's better for you. No, there's actual studies that show when you are adhering to that Mediterranean diet, your brain is healthier. Even if you are in an area of high pollution, even if you have exposure to different chemicals. This is something that is really, really critical because we all want to age gracefully. And at the end of the day, our diet can make a difference. Now, one thing that we know is that because a standard American diet is generally lacking so much in omega-3 fatty acid exposure, many people do not adhere to the Mediterranean diet, then supplementation of omega-3s is certainly really important. So we look at things such as fish oil, krill oil, flaxseed oil. Interestingly enough, they used to always, and they still do, try to say, oh, taking supplements of fish oil, that doesn't do anything for your health and that's all hogwash. No, I will say that there's certainly a difference in terms of quality. You can find a lot of fish oils. You can, go to some of these big box stores and you can get enough fish oil for an entire year, probably for $10. So that's an exaggeration, clearly, but it's not a high quality. So quality matters. When you are utilizing fish oil or krill oil, you want to make sure that it is sourced, number one, environmentally correctly. You also want to make sure that it goes through the proper distillation process. So it's removing any type of impurities from that fish or from that krill. So this is why our formulation, so if you go to Invite Health and you check out our fish oil or our krill oil advanced, you'll see that we go through extensive lengths to make sure that we are bringing you the highest quality, highest potency, as well as the highest purity. Now, back many years ago, it's probably about 15 years ago now, there was this aha moment in the pharmaceutical world where they said, we need to come up with our own fish oil. And they did. So the FDA approved fish oil as a prescription drug, which was really kind of funny because for years they kept saying, you don't need to take fish oil. You don't need fish oil. And then all of a sudden, boom, overnight, here's this, brand new prescription fish oil. Now, what was really crazy about this prescription fish oil was it's not like it was, super duper high strength and compared to what you would be getting, say, from the Invite Health. This is not what it was. But price-wise, oh Oh yes, it was very expensive, and people still are prescribed this, and it can run you upwards of $300 a month. I mean, it's just outrageous for fish oil, but it's a prescription. So some people feel like, oh, it must be somehow better. Just really kind of ironic. We know that the FDA oftentimes has a means of pushing things through that haven't been well studied and proven. But in the setting of fish oil, we already knew this. We're like, well, yeah, fish oil is going to work because people in the natural world have been using fish oil for years and have been researching it for all of its many uses in the human body. So it's just sometimes just kind of outrageous when you think about it. But one thing that I always like to encourage people to do is to know what your fatty acid level is. This is not a hard thing to do. You can have a fatty acid blood test done. It's very, very easy to do. And it's going to let you know how much omega-6 fatty acid do you have in your blood, how much omega-3 fatty acid do you have in your blood. Just so you know, that test should come back showing that you have 2 omega-6 to every 1 omega-3. But the average American test is 20 omega-6 to every 1 omega-3. That's a huge problem in terms of looking at that ratio, which should be 2 to 1, and Americans test back at 20 to 1 on the average. That's a problem because what that indicates is that we have so much omega-6 fatty acids, which can then become pro-inflammatory, versus having enough omega-3s, which would actually work in the opposite and ease inflammation. So this is something that we know. We also know that even now that the FDA has acted on recommendations of researchers and physicians to say that fish oil, this drug that they now allow to be prescribed to people, is beneficial for reducing heart attack, stroke, and death in high-risk patients. And this decision that was brought on by the FDA was largely based on a study that was published in the New England Journal of Medicine, showing that people taking high doses of fish oil, and this is the fish oil drug, the prescribed drug, that they had a major reduction in cardiovascular death, as well as looking at strokes and the need for bypass surgeries and having angina, chest pains. So these are all things that they were able to recognize. Now, when they first came out with this fish oil drug, the prescription, they were marketing it towards lowering triglycerides. And I think that that's a wonderful thing. We've already known that. We know that omega-3 fatty acids can help to lower your triglycerides. I always tell people, if you follow the right supplementation routine, if you're doing the right thing in your diet, you will see the difference. I know myself, just from looking at numerous blood test results, when someone is adhering to their routine of taking 1,000, 2,000 milligrams of omega-3 fatty acids per day, and then seeing what's happening with their triglycerides, you see that triglyceride level starts to go down. Now, everything, it's not just fish oil or krill oil alone. It has to come down with lifestyle modification, trying to adhere to that Mediterranean style diet, having higher fiber. There's a lot of different factors. But what is really quite interesting is that we continuously keep seeing time after time the benefits of this. There's a reason why people who adhere to a Mediterranean diet have lower risk of dementia and Alzheimer's, have lower risk of cardiovascular disease, have lower likelihood of having issues such as arthritis. So you can look at all of the different factors. Having these omega-3 fatty acids in the system are essential and definitely underplayed in terms of their importance. Most people go about their day and they don't really think about, did I get my omega-3s today? But that's part of the reason is because we just don't stress it enough in terms of a healthy diet. Most Americans, think if they have a fish stick or something, that might be their exposure to omega-3. I mean, I hate to say it that way, but that's really the reality. So supplementing with a good high quality omega-3 fatty acid can make all the difference. Now, say if you are not wanting to take fish oil, You say, that's just not my thing. Then you can use flaxseed. That's going to be your plant-based omega-3 fatty acid. For some people, they like using krill oil. They may find it that maybe the capsule's a little bit smaller. They find it easier. Now, do remember that krill oil, that is from the shellfish family. So if you have a shellfish allergy, you definitely don't want to be doing krill. Fish oil is fine, but you wouldn't want to be doing the krill oil. So these are all just things that people should just know about. But when it comes to how much should you be taking on a regular basis, this is also a really important question that people should be asking. I always say at least 1,000 milligrams of omega-3 fatty acid exposure per day. Now, depending upon what someone's needs are, if someone has really elevated triglycerides, you may be up higher to 2,000, 4,000 milligrams of omega-3s per day. So it's going to vary from one person to the next. Or, if someone's dealing with issues with dementia or anxiety, or if someone has arthritis, there's different ways in which you would utilize your omega-3 supplements based off of that. Now, those are always excellent questions that you can reach out to one of our health experts on. So we have so many experts that are available that can, assist you with any questions that you may have when it comes to, are you taking the right things and are you taking the right amount of these different nutrients? So do keep that in mind, but I just wanted to give you just this latest update when it comes to the benefits of omega-3s. Good for your brain, good for your heart, good for overall health and wellness. I want to thank you so much for tuning in to the Invite Health podcast. Remember, you can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Now, do make sure that you subscribe, you leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health, and we will see you next time for another episode of the Invite Health podcast.